Another major issue here is that where it is recognised, local knowledge is often valued for aiding implementation and acceptability of global solutions, but it's not seen as able to question the motives, values and worldviews inscribed within global mental health projects and interventions. So the WHO and the movement for global mental health have been criticised for failing to consider how efforts to scale up mental health services may actually undermine or subjugate local understanding and forms of support, as White and Felicia talk about. So we've seen these kinds of figures about prevalence and how important they are to global mental health, but the contextual nature of mental distress makes calculations of its global prevalence really quite problematic. So there might indeed be people all over the world who experience distress, right? But a question is if it's valid or not, and useful to people even, to frame that distress through psychiatric categories that are largely coming from the global north. And even in the global north, their meaningfulness is under question, and they're often critiqued, seriously critiqued. And so one of the potential problems with doing this, with coming up with these kinds of prevalence figures, is that it frames multiple different experiences of distress. So things that might be, in the language of psychiatry, diagnosed as psychosis, alongside things that might be diagnosed as depression, it makes them seem as if they all share a biological base, and reinforces global mental health as a medical kind of problem, Jocelyn Clark talks about. And that framing enables advocates of global mental health to draw analogies between disorders that have got known biological components or causes, for example, epilepsy, and also those without, such as continuing debates around depression, and use this to prioritise access to treatment. And sometimes this is a very political move by global mental health that's been hugely successful, okay? So that's why we are in fact seeing a lot more funding and a lot more interest in mental health globally, is the sort of cultural, the importance of the cultural and political claim of the universality of mental health, and that it's a medical kind of problem. But that also brings with it a whole other set of issues.